Hello, everybody. Thank you so much for joining me. I'm Michelle Hayward, and tonight we are going to be having a special discussion around National Minority Health Month. Tonight, I have one of my college friends, and we won't say how long ago we were in college when we graduated, but we graduated maybe 2, 3 times. I'm just going to say we started when we were 5, but I have with us Dr. Asha Bailey. She's a South Carolina native, a Clemson University graduate, as well as a graduate of this little medical school in Philadelphia. And she has been practicing nephrology for over 10 years now, here specifically in the state of South Carolina. And so I always bring on different people on my network, but I haven't brought on anybody that has known me before I had these gray hairs and who has not known me since I had this much hair. So she saw me the other day and she was like, "What is all this hair?" She's never seen me with this amount of hair, just so y'all know. I'm not about this. So, Dr. Bailey, I'm gonna call you. Do I have to call you Dr. Bailey? Okay,
No.
good. Okay, Aisha, because I'm like, I ain't never called you Dr. Bailey, except if I need. So, Aisha, thank you so much for joining us. Let the audience know a bit about whatever I left out of your bio so they know, like, how you, let's talk about that. Like, what made you decide to go and get into medicine, become a doctor?
Well, thank you, Michelle, for that introduction. Definitely. I'd like to thank you for allowing me to use your platform to talk about something I'm very passionate about with it, which is the health of our community. Taking care of our community. That's a big part of what I do every day. But just to answer your question about why I chose medicine, when I was a kid, everybody goes to the doctor, and I didn't see doctors that looked like me when I was younger, and that was I think one of the driving forces, and that's one of the things that kind of keeps me, I guess, kind of grounded, and keeps me focused on what I do, because I want my patients to see a physician that looks like them, and I also want them to truly understand and feel that I want to take care of them and I care about them.
Thank you for that, Aisha. So you get this degree in you're in medical school, rather, not medicine school, but medical school. How did you decide on the kidney? Because I know we had some conversations back in the day, the early
Sure.
2000s, but how did you end up deciding on the kidney?
When we go into medical school, the last 2 years we do clinical clerkships where you get to experience medicine firsthand. So you're in there with the patients, the attending physician, and you're kind of grasping everything that they're doing. So from there, what I knew I wanted to do, what I figured out what I did not want to do was surgery. I knew that I didn't want the kind of lifestyle that they had. I give more power to them. They do things that I could never do. I chose internal medicine because internal medicine, in my opinion, is the gateway to everything, every specialty: cardiology, hematology, oncology, pulmonology. That's basically the gateway to everything. Now, I did my residency and fellowship at Wake Forest Baptist Medical Center in Winston-Salem, North Carolina. And that's a big academic institution, if you don't know. And there you have all the subspecialties. So I was able to, rotate with the cardiologist, the gastroenterologist. And then there was the nephrology ward service that I was on. This is a service or a specialty that a lot of people kind of look the other way. They think that patients are very complicated, they're very sick, and it's just kind of hard to understand all the physiology that goes with the kidneys. But when I did this rotation, I had all those things in mind, but these are the people that I felt like these were my people. What nephrology offered me was basically I got to see all facets of medicines. I got to see patients that did well. I got to see patients on dialysis. I got to see transplant patients. I got to see critically ill patients. Believe it or not, we take care of gunshot wounds because unfortunately when things like that happen, these people have a whole lot of complications, and their kidneys are one of the main things that can shut down. So nephrology, along with many of the other specialties, just offers you a whole variety of different aspects of medicine. But I got to practice just critical care medicine along with just seeing, my routine chronic kidney disease patients.
And I'm glad you brought that up about how people often overlook the kidneys. I would say often when we think about major organs, right? We
So
think about
much.
our heart first. We're going to think about our skin as an organ, our
Sure.
lungs.
Yeah.
We don't often think about our kidney. And I want to talk a bit about what happens early on that we may be doing to impact our kidney health,
Sure.
especially in
Yeah.
Black, Hispanic, and other minority
Gotcha.
communities.
You made a great point just now. People don't think about the kidneys until the kidneys go down. It's just one of those things that, and it doesn't have a lot of symptoms. Kidney disease doesn't present with a lot of symptoms early on. So that's why it's important, for anybody, regardless of how you feel, how you take care of yourself, everybody needs to go to the doctor on a routine basis, because that's where we pick up things early. And that's the goal with medicine. You have to pick up things early, because if we can pick it up early, there's a good chance that maybe we can salvage or preserve what you got. Okay. And I know you mentioned just what kidney, we're going to call it what it is. It's called chronic kidney disease. There are different varieties or different degrees of kidney disease. There's a little bit of kidney disease, and then there's people that have a lot of kidney disease, meaning they're on dialysis or close to it, or they've had a kidney transplant, those kind of things. So kidney disease has a very wide spectrum. There are a few things, or a couple different risk factors, unfortunately, that I have to talk to patients about on a daily basis. So when we talk about kidney disease in essence just means your kidneys are weak. They're not doing everything that they should be. And our goal as kidney doctors is really honestly try to figure out what the problem is and hopefully preserve. A lot of times we can't go back in time and make things better. A lot of patients think that. The goal when you come and see me, we're just trying to hold on. That's it. Because you don't have to have 100% kidney function. You just need enough. But the goal is to figure out what is causing it. So when we talk about kidney disease, again, there are two main things. There are actually two to three main risk factors for kidney disease. Things like diabetes. Everybody knows what diabetes is. You have hypertension. And then there's another thing that I think a lot of people overlook. It's kind of the elephant in the room, and it's obesity. That is a major contributor, especially in our community, to kidney disease. When we talk about, and I'll just kind of give a little spiel on each one of those three things. Let's talk about diabetes just briefly. Diabetes, 10% of the US population, or 32 million people, have diabetes. That's an astronomical number. But when you look at African Americans, 12% of African Americans have diabetes. That is huge. Diabetes is the 7th leading cause of death in the US. Again, we all know what diabetes is. We know some risk factors. Risk factors of diabetes, unfortunately, a lot of it is genetic when you think about it. African Americans and Hispanics, unfortunately, have a higher incidence of diabetes. Anybody in their 40s, 45, myself included, is at risk for diabetes. So the older we get, your risk of diabetes goes up. Anybody that has hypertension, anybody that is overweight or obese. But also another thing, and I think people may not realize, gestational diabetes is a risk factor down the road. What gestational diabetes is diabetes that develops when you are pregnant. A lot of times once you have the baby, the diabetes resolves and everybody's fine. But usually about 8 to 10 years later, that person will come down with full-blown diabetes. So that is one of those things where if you have a diagnosis of gestational diabetes when you were pregnant, you got to be super aggressive about trying to reduce your risk. That meaning exercise, that a good diet, watching your weight, all these things that are really honestly just common sense. You got to do it. Okay. There are a lot of signs and symptoms for diabetes. That's why it's very important to go to your doctor. But if you're experiencing like going to the bathroom a lot or going to urinate, that should really be checked into. Okay. Weight loss and weight gain are signs of diabetes. More advanced cases, or when you've had diabetes for a longer period of time, and sometimes people just don't know it, they miss the signs, but they can have vision problems or even nerve problems. You'll hear people say that they have numbness and tingling in their fingers and their feet. All of those are symptoms. We have to recognize when things are not right and then go and investigate it. Okay. But that's diabetes is a huge risk factor. And the thing about when we talk about kidney disease and diabetes, we're not talking about necessarily the immediate, the present. What I'm trying to do is when I get consulted to see a patient that got diabetes, usually there's some signs in their blood work or urine that's the reason they referred to me. I'm not really that concerned about the present. What I'm trying to prevent is 5-10 years down the road where your kidney function, we don't want to see your kidney function get worse. Okay. So that's why it's super important for us to go to your doctor, know your numbers, ask questions. Don't just let us tell you to do this and do that. You gotta, tell us if a medicine isn't, if you're not tolerating a medication well. But I encourage you to ask questions, be actively involved and educated in your own health, especially with diabetes. Okay. We can talk about hypertension. Hypertension is the number 2 cause. I can't tell you how many young African American males that I see in my dialysis clinic. I mean, I'm talking about people in their 20s, in their 30s, prime of life. They had this horrible blood pressure. They haven't been going to the doctor for whatever reason. And all of a sudden they get these horrible, symptoms where they're swelling up, they're having chest pain, and that's what causes them to go to the doctor. And then we get the numbers back, and it's showing that your kidney function is quite reduced, or you're having signs of other sequelae from poorly controlled blood pressure. Again, I'm going to emphasize this throughout, the time that I'm here. You got to go to the doctor. You don't go to the doctor just when you're feeling well. You go to the doctor when you're not, you got to go to the doctor. Just like you go to the dentist to get every 6 months for your routine cleaning, or we should be. You got to go to the doctor for us to check these things out, because hypertension is a silent killer. You are not going to have symptoms of your blood pressure being super high until damage is done, until you're on the verge of having a heart attack. You have coronary artery disease. It's knocked your kidney function out. This is the scenario that I see quite often when I see these young guys that come in, they're on dialysis in their 30s or late 20s, and it's just a situation that can be prevented if we have early detection. And early detection is honestly going to the doctor, but it's also doing your part as far as your diet, your exercise, cutting down on the salt, cutting down on not even cutting down, but eliminating the tobacco. That's a major issue. Also, excessive alcohol use contributes to hypertension. But usually there's an easy remedy for hypertension or high blood pressure. It's really taking your medications and a proper diet and exercise. That's really the usual remedy for hypertension. Okay. I think I also want to mention obesity. A lot of times people just don't want to talk about it, but we have to talk about it, because obesity is a contributing factor to diabetes and hypertension. There are many things within that can go wrong with the body, and a lot of things we can't necessarily cure. I always tell my patients, you can have your diabetes, you can have high blood pressure, you can even have kidney disease, but you can't let these conditions have you. We have to, rectify or fix what we can fix. And a lot of times, in 90%, 80-90% of the time, we can do something about our weight. We can do something about smoking, decreasing our alcohol intake, improving our diet and exercise. Those are things that we can do. Now, we cannot do anything about the the genetics, like things that run in the family. Like we all have diabetics in our family, all people with high blood pressure. And unfortunately, there's no change in that. But we have to modify the things that we can modify.
Thank you for that. We do have a question. What are the primary testing that primary care doctors can test to
Sure.
check the kidneys? Is
Okay.
is it the general information from your normal blood lipid panel?
It truly is. Your regular doctor or primary care physician is checking the same labs. I just go a little bit more in detail when you arrive at my office, but there is a lab called the creatinine. This is a blood test. It measures your kidney function. If your kidneys are working okay, that number is around 1 or less. Anything over 1 is considered to some degree abnormal and should be checked out. But the other thing about when you're looking at your kidneys, it's also a blood and a urine test. So we talked about the blood test, which is the creatinine, the urine test. So that's just a simple urine dipstick. You go into the doctor and they ask for a urine sample. We're not necessarily testing you for drugs or anything. What we are looking for is evidence of blood and protein, because we shouldn't see any of that in your urine. If that is present, that is honestly an automatic referral to a nephrologist. So it's actually 2 tests that we utilize to determine how well your kidneys are doing. It's a blood test. Specifically, it's called the creatinine. Okay. And the other test is a urine test. And those are tests that honestly, if you're going to the doctor every year, or if you have other ongoing medical problems and you go more frequently, they're going to check those every 3 to 6 months. And we can pick those patients up quite frequently. A lot of times it is a simple remedy to modifying the diet, exercise, but maybe incorporating a special medicine that really targets this issue.
Thank you for that, Asha. A question, or as we're talking about the things that lead to kidney health or kidneys not functioning normally, let's look at the impact of COVID-19 on Black and Hispanic communities, and how is that also impacting kidney health?
COVID has been an absolute disaster for all communities, not just the minority communities, but what it has done, and it's something that we've all known. We know that medical care is not the same for different populations. There's a highly underserved population. Like I work in Columbia, in a very urban area, and it has brought out things that we've actually tried to make some changes, but granted we haven't done enough. But COVID in general, I have seen it affect every body system every body system. It has wreaked havoc. I was talking to Michelle several days ago about, we have patients that have, their kidney function is a little bit weak. People have gotten COVID and it's tipped them over to needing dialysis chronically, meaning going to a center 3 days a week and getting your blood cleaned by a machine. That's how severe COVID has been. We've had a lot of dialysis patients that have unfortunately succumbed to the illness, because when your kidney function is quite weak, you're on dialysis or even have transplant, you're at a very high risk for if you catch pneumonia, you catch any type of infection, it can really tip you over and cause a whole host of complications. Whereas you compare it to someone that doesn't have kidney disease or doesn't have some of these other risk factors, it still may wreak havoc, but it may not be as severe in patients that don't have these other risk factors. But I have seen COVID, I can honestly tell you probably at least 10 of my dialysis patients unfortunately are no longer with us because of COVID. And I have a clinic of 80 patients. And throughout the Columbia and the surrounding cities, we have probably between I would say 12 to 15 dialysis clinics that have 80 plus patients. So I'm telling you, I've lost probably between 8 to 10 patients out of 80. That's a staggering number. Um, I can't even count how many patients that I've unfortunately had to, start dialysis because of exposure to this virus. So when we tell you to get the vaccinations, we are truly trying to minimize your complications associated with this virus. It has been devastating, as you all know, if you look at the news or social media, to many communities, but it's definitely been horrendous for the African American community.
When it comes to testing, do doctors need to look at testing results differently for Black communities, Hispanic communities, Asian communities, and mixed race people differently because of genetics?
So to a certain degree, we do that, but actually, you brought up a great point, because all before, up until like maybe 6, 9 months ago, there was a difference in the way you interpret the kidney numbers for African Americans. It's not necessarily for Hispanics or Asians or anybody, but it was specifically when you look at African Americans, the number was interpreted a little bit differently. However, most labs and or practices are now not looking at race whatsoever. The number is a number. We're going to look at that number the same if it was a Caucasian, Hispanic, or African American, which is actually, in my opinion, a good thing, because I think all before, there may have been a slower reaction time to African Americans with that test, but now everybody's on the same level. What the test kind of looked at body mass. African Americans a lot of times are a little bit more muscular, so that's what the test kind of took into consideration. But now I feel like with everything on a level playing field, we're going to actually see patients being referred to me sooner, in hopes that we can save their kidney function.
So we've talked about what is kidney disease,
Sure.
what leads to it, the impact of COVID. What can people do to prevent kidney disease?
The one thing you can do to prevent kidney disease, there's a lot of things that you can do to prevent kidney disease. I would say the number one thing is that you got to get it in your mind that, and you got to value your health. You got to get that in your mind that you're only given this one body. We got to value it. We got to take pride in our health. And we got to learn to be educated. You don't have to learn the medical lingo like I know it, but you need to go into an office and not let someone per se dictate to you. You need to understand what these numbers mean. You need to understand the medications. You need to also tell us. I can't tell you how many times I see patients and I'm telling them, oh, we're close to dialysis. They don't have a question. It's impossible not to have a question if I'm telling you that we are approaching dialysis. I love when, especially with my the males that come in. I love when their wife or significant other or the kids come with them, because they really tell the story. I always tell people, bring your family members. 4 years are better than 2. But the main thing is that we got to, number one, value our health. Your health is not guaranteed. You got to, become educated to some degree. If I'm talking to you on a level that you don't understand, you got to let me know. We got to bring that down, because my number one thing when I tell my patients when we're finished with our interaction, I was like, I need for you to be able to tell your wife or tell your kids what we talked about. And I'm going to make it as simple as possible, because I'm a simple person. I don't, we don't need all that high-tech language to get the point across. Those are the main things. But, again, it comes down to common sense too. We know that we can't eat fast food every day. We know that we need to do some form of exercise. No, you don't have to run a marathon. That's not necessary. I got a bad knee. I can't do it. But what I do is make a concerted effort to do some form of physical activity. at least 5 to 6 days a week. And that's usually about 30 minutes. I'm not going to do much more than that. But I also, watch my diet. I don't do a lot of carbs. I don't eat out as much. I actually do a lot of meal prepping. So I don't, that's just the way. But I think, being healthy means different things to different people. You don't have to, do it like I do it. But I think, cutting back on, high fatty foods, the salt, the fast food, all the processed foods, and incorporating diet and exercise, I think you're well on your way.
Thank you for that, Asha. So, everybody, if you are joining us with this live on the replay, I'm going to give you the opportunity to connect with Asha. So, Asha, where should they go to connect with you on Facebook?
I have a Facebook page. It's basically Dr. Asha Bailey.
Oh, it is Dr. Asha Bailey.
Yeah, it's Doc. Yeah.
Well, somebody sent me this. I don't know who it was.
Yeah, you can actually pull if you do it that way on Facebook. I'm just saying, I'm just speaking in general. You can actually pull me up that way also. That's
okay,
fine.
Dr.
But I
Bailey,
usually, when I pull up names, you can just put in my full name, Asha Bailey, and you'll see probably like 2 profiles.
Okay, cool. And what do you speak about? How can people get you to come and do a paid speaking engagement with their organization?
I'm just, I mean, I'm pretty easy to contact. I had a organization a couple weeks ago reach out to me, and they just wanted basically information on, chronic kidney disease, prevention, risk factors. It was about an hour talk. But no, I'm really accessible. Email is the best way. I'm usually on Facebook a few times throughout the day. So yeah.
So y'all know where to reach her. If you're in the state of South Carolina and you're looking for a Black doctor who specializes in kidneys, now you have a referral. If you're in the low country, it's a little bit of drive. If you're in the upstate, it's a little bit of drive. But I would say you have an option if you want a doctor who looks like you and can understand some things about you on a cultural basis. So Asha, thank you so much for joining me tonight, and everybody, I really appreciate it. Everybody, we will be back later on this week on Thursday for our DEI Thursdays. They are back. I took a hiatus because I needed a break. We'll be back, and we'll be talking about barriers to really cultural change in organizations. So I have 2 guests that'll be joining me talking about that and what white management teams should be doing in organizations. So definitely come join me. Everybody have a great week, and until Thursday, I'll see you then.
All right. Thank you, Michelle.
You're welcome.